won't be wearing gloves. Hello, my name is Jordan. I will be your nurse today, providing for privacy. All right, so beginning first. So if you have any hand sanitized, have you noticed? Can you please state your name and date of birth for me?
I'm Hannah Chandler, 10/21/19.
Can I check your wristband, please? Perfect. Looks like the doctor has put in an order for you to get a musculoskeletal system assessment done. So basically just checking over all of your muscles, your joints, and looking at your range of motion of things and all that. Let's see. All of my equipment is clean and ready for use. Are you in a comfortable position?
Yes.
Okay. Go ahead and take off your sweatshirt for me, please. And your
I'm going to do capillary refill.
And I am going to do a brain dump while you are doing that.
All right, now we'll do the toes. She has nail polish on, so we'll do the same thing. All right, and both the fingers and the toes refilled in 2 to 3 seconds, so that's perfect. All right, now I'm looking at her face now. Her lips are not dry or cracked. They look good. They're pink. I'll have you open your mouth. And I'm just looking at the pupil mucosa and her gums and her tongue. You can lift up your tongue or just look underneath. All right, so I was looking for any lesions or abnormal bumps or anything. There wasn't any. Her pupil mucosa and gums were moist, and her tongue was moist and smooth. No lesions or anything. All right, now I'm going to feel your skin here. So we have bilaterally. So they are the same color, the same temperature. Can you move your arms? All right, she can move them. She has movement, and can you feel this? No. All right, so she has sensation as well. So we'll do the same thing with the legs. All right, so the temperature is the same. She's not too warm. Same with the arms. She's not too warm and she's not cold. Can you move your legs? Perfect. And then can you feel this? All right, so her color is good. It matches the rest of her body. She has sensation. She can move it. Temperature is good.
All right, I think I have everything. I'm just double checking.
All right, we're going to do musculoskeletal now. Okay, so have you ever broken a bone? Have you ever had surgery on your bones or joints?
Okay, I think I have everything here. Okay. Thank you for being patient with me. So I'm going to ask you, do you have any allergies? Okay. For this assessment, I will not need any PPE.
Yeah, I'll have you go like that. So right now I am just for my introduction here.
So first, I'm going to ask you a couple of questions. Do you have any coordination problems? Do you have any loss of balance issues? Have you ever injured any of your joints, bones, muscles? No? Okay. All right, so we're going to move on here. I'm going to have you stand up for me. And just have your feet together, arms down. I'm just going to take a look at your posture.
All right. And I was looking.
So the head is midline with the body. It looks good. Can you turn around for me?
Kyphosis, which is outward curvature of the upper
Perfect.
spine. Scoliosis,
I am going to
which is an S curvature.
Look at the spine here. It is midline with the body. I'd be checking for scoliosis, lordosis, or kyphosis.
So now
Patient
we are
is
going to assess your mobility and gait.
normal, doesn't have any of those abnormalities. So I can have you sit back down and just get comfortable. I'm going to chart that here, just cross it off. Palpating the spine, it looked good when standing. Can you stand up again? I'm just going to palpate your spine.
Her feet at all. She's able to walk without losing her balance. Didn't look like she was going to fall.
Nothing bulging, nothing looks out of order. It is straight and midline with the body. All right, you can sit back down.
Now I will have you.
Okay, so up next I'm going to observe your gait. So I'm going to have you stand up, and have you walk from the bed to the chair over here, turn around and return, okay? I will move this so you can do it.
And rub it up and down the shin of the other one.
All right, you can start observing, just normal gait.
And then could you walk on your heels?
Do you have any pain while doing that?
Nope.
Okay. Check that off. So now I'm going to have you walk forward on your heels. Good. And then, are you having any pain with that?
Nope.
Do you feel like you're going to lose balance?
No.
All right. Now just heel toe.
And now we will do some range of motion.
Perfect.
No.
All right. Next, can you please walk on your tiptoes for me? Great. Looks good. Keep coming back. Perfect. All right. You can go back and have a seat.
Okay, range of motion. Okay, so let's
All right.
the neck.
So balance looks good. Didn't look like you had any issues with that. Now I'm going to have you hold out your hands for me and go like this. And this is finger opposition, checking your coordination and balance, touching the thumbs. Perfect. No issues there. Now I'm going to have you copy me here. So hold out your hands here. Pronation, flip over, supination, pronation, supination. All right, there are no problems there. All right, can you stand up for me, please? I'm going to inspect for coordination. I'm going to have you take your heel to your other leg and go up and down the tibia here, and fibula, yep. And next foot. Perfect. All right, you can sit back down. Now we're going to do the finger to nose test, okay? So I'm going to hold out my finger here. You're going to touch your nose and then follow my finger. So for example, yeah. So touch my finger, touch your nose, touch my finger, touch your nose, touch my finger. Perfect. Okay? Next, I'm going to just inspect your muscles here. Neck muscles, tricep, arm. I'm doing this bilaterally, checking your hands. All right, legs.
All right, no feet, nothing with that.
All right. Did you have any pain when I was palpating those muscles? Okay. Now I'm going to, so inspection of muscles are good, the palpating good. Now I'm going to have you scoot towards the edge of the bed a little bit. I am going to apply some slight resistance while you are moving and working those muscles, okay? Hold on, let me see here. Sorry, I'm just going to make sure I have everything in order. First, I'm going to start with your hand grip. So for this, I'm going to cross my arms here, and you're going to take and just squeeze my two fingers here as hard as you can. Did you have any pain while doing that? Perfect. All right. Now I'm going to check for your bicep and tricep, so please hold hands like this. And I'm going to have you, like you're doing an arm curl, so like pulling forward, and I'm going to be putting resistance on. Perfect. Any pain with that? All right, that was the bicep and tricep. So hand grip was a 5 on the grading scale. Bicep and tricep was a 5 as well. And now I'm gonna do your leg one at a time. Can you lift your leg for me? Right. Putting resistance on. All right, that would be a 5 on the left upper leg. Same thing. And that would be a 5 as well. Now I'm going to be doing the lower leg. So you're going to be kicking outward while I'm pushing upward, okay? Perfect. Perfect. Any pain while I was doing that? No. Perfect. So that would be a 5 as well. Now we'll be doing your ankles. So for this, I'll have you do plantar flexion, which is putting your foot towards the ground, okay? And I'll be putting resistance on the bottom of your foot. Perfect. Any pain? No. And then hips. Perfect. So that would be a 5. All right. So next, I am going to be inspecting your joints. So for this, I'll be looking at your chin. So I'm going to have you flex your chin or your neck, extend, go back like this, rotate left to right, looks good, and then ear to shoulder on both sides. Looks good. Did you have any discomfort when you're doing that? No. Perfect. Now I'm going to do your chin here. Can you go side to side for me? Any pain? Open and close your mouth. No pain? Okay. And then can you lift your chin out like that? Perfect. All right. Now I'm going to do your spine. So can you stand up for me? All right. Can you bend forward for me? Looks good. That's flexing. And then go back would be extension. Looks good. And then I'm going to have you rotate left and right. Do you have any pain? No. All right. You can sit back down. Next, we'll be doing your shoulder. So for this, can you lift your arm up and then back down, and then the other side, up and down. So flexion, that was adduction and abduction. Abduction was away from the body, and then putting it down was adduction towards the body. Now I'll be having you go forward and then down. Any pain with that? Okay. Next, I will have you do your arm and elbow, which is kind of what we did there. But, so can you go like this? Flexion, extension. Oh, her nails. I would have done this with. All right. Any problems there? All right. So for wrist, I'll have you hold out your hands like this. Describe the color, the shade, and so flexion, extension, flexion, extension. No pain. All right. And then now I'll be doing your hip. So for this, can you stand up for me, please? So for the hip, I'll have you go out and then in, abduction, adduction, and then on the other side. Did you have any pain with that? Nope. All right, can you lift your leg up and then down? So that's flexion of the hip is pulling it up, extension. Perfect. Can you do it with the other side? And then can you extend backwards? Perfect. Perfect. So she did it on both sides with no pain. Next, I will have you do the knee so you can sit down. So for this, I'll have you extend your knee out. Perfect. And then bend back, flexion, Extend. Can you extend it again? Perfect. Okay. Next one. Lift it out, extension, and then back down would be flexion. All right, looks good. Did you have any pain? All right, now I'm going to have you plantar flexion and dorsiflexion like we did earlier. So plant your foot, plantar flexion, lift up your dorsiflexion, perfect, plantar flexion. Okay, now I'm going to palpate these joints while you're doing them. Okay, so with this one, lift your head, extend your neck, so look back, perfect, and then look forward, flexion, looks good, and then can I have you look left and right, perfect, and then look down, I already have you do that, sorry, and then ear to shoulder. The next one, any pain there? No. Feels good. Okay, now I'm going to have you do your jaw, so side to side. Good, feels good. And then open and close. Perfect. And then kind of stick out your chin. Perfect. All right, now, so that was neck and temporal mandibular joint. Now I'm going to do your shoulders. So can you lift up your shoulder? And then down. Perfect. Down. And then I'm going to have you hold out your arms and then adduct and abduct and abduct. Okay? Perfect. And then I'll have you do one at a time. Sorry. Perfect. Perfect. Feels good. Okay. Next, we will do bicep. Sorry. Next, we'll do arm and elbow. So hold out one arm at first. So flex like this. So flex like that way. Okay. And go back down. And do it again. Perfect. And flex and then extend it again. Perfect. And then next we'll do the wrists. So like that again. Perfect. Feels good. No pain with that. All right. And then can you stand up, please? We'll do the hip again. All right. And then lift up. All right. Down. Up. Down. Perfect. And then adduct. Abduct. Perfect. Perfect. Adduct and abduction was good of the hip. And then can you go back and extend? Perfect. And go back again. Perfect. Okay, now we're going to do the knee so you can sit down. All right. Now I'll have you extend outward and then back in. Perfect. Next one. And back. Perfect. Any pain there? All right. Now we'll do the ankle. Okay. I want you to point this foot downward. All right. Back up. And then dorsiflex, so lift it up. Perfect. All right. Now put the foot down to the ground. Perfect. And then now you can lift the foot back up. Any pain with that? Nope. All right, your joints feel good. Nothing abnormal there. Okay. And I think that is everything. I'm trying to think if I missed anything with the hip. Did I have you rotate the hip? Can you stand up for me, please? So for this, I'll have you rotate the hip like that. on both sides. Any pain with that? All right, now I'm gonna feel while you do it. Perfect. Perfect. Okay, you can sit back down. Okay, so I think that is the end of your assessment. Muscle size was normal. For your body, it was uniform with your body type. And then I didn't feel any bumps or anything abnormal there, no bruising or anything. And did you experience any pain with any of the assessment? Okay. Muscles were symmetrical to the body, size, shape, contour, everything looked good. And I think that wraps up our assessment. I'm going to sanitize my hands. Did you have any questions for me? I have time. Nope. Okay, you can put on your shirt and please call if you have any questions for us, okay? Here's your call light. Head is locked, side rails are locked. Pathway is clear. Everything is sanitized and ready for use. I think that is it. All right, thank you.